Okay, Liz, if you could share a little bit about just a brief overview of the process from kind of when you first logged on to the very end with your post session discussion, what happens in these sessions?
So, you had sent me an email with confirming the time and date, and then a Zoom link. So, about 5 minutes before, I clicked on the link, and it brought me right into the room with the moderator, which was an associate professor from UMD. He welcomed me, and I saw that there were two other students on there. In total, there were a med student, physical therapy student, a PT, and a nurse. So that process was really easy.
So after you kind of get in there and you get to see who the other providers are in the situation, um, how do you know kind of where to go? Do you get a case? Do they give you any information on the client? Do you get to meet the client? What happens next?
Yeah. So briefly, the moderator put in the chat as well as verbalized very briefly. We had an older gentleman that had a fall, and that was about it. So, and I had a notebook and a pen just to kind of take some notes. So, um, then the actor, the patient client came on, and the moderators put us in order. So the nursing student went first, then the med student, and then I was third, and then the PT student was last. So I believe right away, the nursing student said, went started questioning about the fall. Tell me about your fall. And then blood pressure things, a lot of just narrowing down about his physical symptoms. And then we had 8 minutes each, sorry to put in there. So then it was my turn, and I picked up on where the med student went off and kind of dove a little deeper and kind of re-summarized what the med student had said about I introduced myself and my role in the team, um, and he was appreciative of that. And then some of my questions were, "Tell me more about your partner and the support you get," because I was not going to focus on the medical part, but I wanted to focus on his needs being met in the home, his insurance, which was a huge deal. So after it was my turn, then the physical therapy student went. I learned the most from him. He said, "Walk me through the day in your home." So he did, and he not only walked through the medical part, but his relationships, his nutrition, and so those questions helped fill in where I lacked in my questioning. And then after the actor was done and he thanked us all and said, "Gosh, if I had you guys as a team, I'd be in good shape." So then we were able to process it as a group with our moderator. And that was very positive because we each were able to give constructive feedback on what we liked from our different fellow students. And they appreciated the social work perspective of how I listened, and I didn't rush him, and some of the questions that I asked. So that was really nice. Um, and it was all very positive experience. I learned that I needed to really be careful and approach this as from a macro, meso, and micro view.
So, after going through this experience, do you have a sense of how this might affect your actual practice moving forward?
I am definitely going to make sure that I try to educate myself and attend trainings, workshops just on mental health and the medical common things that may come up for clients, diabetes, different things, so that I'm more aware and that I have interventions that I can have in my pocket. I also feel very strongly now that contacting the medical team for my clients is really important. If they have chronic illness, or if there's some things that come up in the biopsychosocial assessment that kind of is a red flag as far as their physical component. So I definitely have a greater appreciation, and I definitely will plan to reach out to other team members where if it's the primary care, physical therapy. So I'm I'm looking forward to doing that.
Okay. So I think you've already shared some really good tips, you know, one sort of being um, be prepared where if folks ask questions that you might ask, rather than asking the same question, maybe going a little bit deeper based on the information that an OT or a med or a pharmacy provider might ask as a part of their assessment of the situation. Um, I think you also mentioned getting there 5 minutes early, which is so that you can kind of settle in and get yourself oriented to the situation. Any other tips that you would provide to other students who are thinking about doing this, who may feel a little bit tentative about, making the leap and jumping into a situation like this?
Um, I would say it's very supportive. It's fun. I learned a lot. Just do your deep breathing or your de-stressing exercises before, and just know that the other students are as, you know, anxious as we are. But I think they have a tougher time as far as, the blood pressure and tell me about this. And, kind of, I think they're walking through a lot of different points in their head than possibly maybe we might. But it's a great experience. I had fun. I learned a lot. And I'm definitely going to make some changes when um, input changes when I start seeing clients as far as the medical model and understanding that more.
Awesome. Very good. Well, thanks, Liz, for taking the time to kind of help other students get a sense of what the ISPE would be like and why it would be beneficial to take part in, and that doesn't need to be necessarily a super scary thing, but use those kind of coping behaviors and dive in because it has the capacity to really, um, make sure that you're supporting your clients, not just in the area of mental health, but sort of all areas and being that support in that. So thank you for sharing.
You're welcome.